Hello, friends, and welcome back to the Patient First podcast. I'm your host, Dr. Bryan Laskin, and today we are going to be talking about something that went down in the dental news recently. I like talking about dental news a lot on the Upgrade Update within Upgrade Dental to our VIP members, because I think that then we talk a little bit more directly to dentists who are looking to grow their practices. But here we have something that directly affects patients too. So I wanted to talk about it on the podcast. What I'm talking about is that the FDA has begun looking into a product, the Anterior Growth Guidance Appliance, or AGGA, that the FDA is looking into. Now, Kara Tannenbaum, who's a former former senior FDA policy advisor in the Device Center, said that the FDA should investigate this product, and it's been in over 10,000 dental patients' mouths, according to court records. What she said is the FDA is looking at what authorities may have around this device, what they may be able to do. Now, of course, whether or not this device is FDA regulated, she said, it still needs to be safe. This AGGA appliance, sounds like 10,000 dental patients is a lot. However, that's not a lot. If you think about it, there's over 200,000 dental practices in the US, as far as I'm aware. And so what that means is that, could be just a couple practices that did a lot, or, maybe 100 practices that did just a few. So this was a very small appliance, but it was being taught at the Las Vegas Institute, which is a well-known, at least used to be a well-known training company that shows people how to use this appliance. Now, let me start by saying something that I think one of the points of this podcast really is start by saying something I wish more people would acknowledge. I know absolutely nothing about AGGA other than what I saw in the news and the little bit of internet research that I did today. I've never been in the Las Vegas Institute, although I do know quite a few talented dentists that have been to the Las Vegas Institute, and that's key to their knowledge of doing cosmetic dentistry, veneers, and so on. And to my knowledge, they never did AGGA, and I would think that they did not, because these dentists did not do any orthodontic treatment, as far as I'm aware. So I don't think this is the people that I know that went to the Las Vegas Institute had great experiences. The dentists that I know, I don't know anything about AGGA, but let's face it, dentistry and healthcare in general has risks. And it's up to us as clinicians, dentists, physicians, to be able to weigh those risks and select patients that treatments are appropriate for. And AGGA, whether or not it, like many other treatments, is effective in many cases, not in others, and damaging in others, I really have no idea. But it seems that most treatments are that way. If you're not involved in dentistry, if you're a patient, it's quite common that there's treatments that specifically work in certain cases and not in others. And AGGA very well may be one of those. From my limited knowledge from looking up how AGGA works, it doesn't seem like there'd be a broad use case for this to myself personally. So I can see why it hasn't been used in that many patients. However, whether or not AGGA is a treatment that works in some cases, I do not know. But what I do know is that it could very well come down to case selection or even patient adherence. If maybe a patient was supposed to wear appliance for 2 weeks, but they wore it for 2 months, I mean, that could obviously have implications. And I'm not pointing the finger at the patients here. I'm just saying that I don't know what's going on, but it seems like AGGA at best would have limited uses, limited potential, and some potential downsides. But what I do know about, what I want to talk about in this case, is the FDA regulations, because people poo poo regulations all the time, particularly FDA regulations, until they're the ones that get hit with the problem. And in my mind, what I do know here is that this appliance falls under, I would guess, and that's a very knowledgeable guess in this case, FDA regulation. And I know many professionals that I work with, that I collaborate with, software companies even, that do the hard work to get FDA approval. And I know that it's a barrier to get through. However, it is vitally important. And I think it should be commended when people, particularly startup companies that are small, go through the hard work to get the credentials to be FDA approved when it's necessary. And in this case, I would think it was necessary. So is this a failure? Yeah, obviously this is a huge failure if it's in the national news and there's people that were harmed. But I don't know where the breakdown does come. But what I do know is that this was not an FDA approved appliance. And we in dentistry and as patients should look to regulated appliances to use in our patient's mouth and peer reviewed. I mean, 10,000 cases is not that much. So this was at best a risky appliance to be using. And it's a reminder for all of us that we should look for, if we're going to be trying a new procedure, it should be either in an education facility where this is where it's being monitored, or something that's approved, whether it's something that is approved, or something that has had a lot of case studies behind it. And I know a lot of the companies that come out with new products, they have the research, they do the work, they work with companies. Heck, the company that I'm part of, as I've talked about twice, the toothpaste company, they've done a large research study with a company called Bristle to look at the how it affects the oral biome. I mean, this is a toothpaste company versus an orthodontic appliance, so we should really look for products that are proven, and of course adhere to good case selection and minimize the complications that can happen from patient adherence. Because I would think that maybe, from my limited research, that might have come into play, at least in a couple of these cases that are going to trial now. And when it comes to software products, look for ones that adhere to the standards of our profession, capital S standards. There's going to be a lot. I'm going to be talking a lot about that because what I've realized is that a big barrier to innovation, and frankly, what puts practices at risk for things like ransomware and other, malware, can be software that is just not adhering to the standards of our professional standards today. Include things like HIPAA, right? I've talked a lot about HIPAA in my past because I feel passionately about our patients' privacy and security. And I think that even now in the year 2023, people are emailing through Gmail or Yahoo email or Apple Mail their radiographs, which is not okay. Those radiographs contain metadata that identify patients, so make sure that you're using a secure email product. There is a bit of tension in everything that we do when it comes to adhering to the protocols and regulations of our profession, but it's necessary. And the AGGA case, in my mind, is really highlights that, because the FDA is not going to know if there's a new small appliance that's being sold to dentists that they're not quite aware of right away. It's going to take some time. And so there's two things with regulations, of course. The rules have to be written, but then they have to be enforced. So somebody has to see that this is going on, report it, or the FDA has to have the funding to find them and go after them. But in this case, it doesn't seem like that was the case. This was not regulated. Whether or not it's a perfectly fine appliance and it was misapplied in some cases, I do not know. But what I do know is that this should have been, and it sounds like that's, at least, even if that isn't the case, certainly the popular opinion at this point, when there's lawsuits about it, that it should have been FDA regulated. Let's get ahead of this. If we're using appliances in our practices, if you're a patient and you're looking to use some new technology, just make sure that it's been approved, that's been used in many cases. And that's the one thing I can learn, I think, to pass along in this case, because again, it's something that I just don't have a lot of knowledge about personally. The AGGA appliance, I don't think it was well known in the profession. The first time I heard of it was on the news when the national news talking about how there's a lawsuit. So it doesn't paint the profession in a great light, obviously. So let's avoid these types of stories and use products that adhere to regulations and to the standards of our profession. That's my 2 cents about AGGA. Let me know what you think of this story. If you have training, if you use AGGA appliances with success, or if you saw it and thought it was crazy, like I did, like maybe there's a use case, I just can't think of one right now, let me know. And appreciate you for listening to the Patient First podcast. And of course, I look forward to seeing you right here next week on the Patient First podcast.